Disclaimer: this podcast is for informational and educational purposes only. It is not medical advice, and it should not replace consultation with a qualified healthcare professional. Always talk with your doctor before starting, stopping, or changing any supplement, medication, or peptide therapy. Today we are diving into Tesamorelin, a synthetic peptide with fascinating potential in health, metabolism, and aging research. Tesamorelin belongs to a family of compounds that act as growth hormone-releasing hormone analogs. That means it mimics the action of naturally occurring growth hormone-releasing hormone, stimulating the pituitary gland to produce and release more growth hormone. By doing this, Tesamorelin has downstream effects on body composition, fat metabolism, muscle mass, and even certain aspects of cognitive and metabolic health. Tesamorelin first gained approval for a very specific medical use. It was approved by the FDA for the reduction of excess abdominal fat in patients with HIV-associated lipodystrophy. Lipodystrophy, in this context, refers to abnormal fat distribution caused by certain antiretroviral medications. Patients often develop visceral fat accumulation, which is not only cosmetically concerning but also metabolically harmful. Tesamorelin showed significant effectiveness in reducing that visceral fat, making it a unique and specialized therapy. Now, let's step back and talk about the mechanism. Tesamorelin is a peptide made up of 44 amino acids. It is a stabilized analog of growth hormone-releasing hormone, which means it has been slightly modified so that it resists breakdown in the body and remains active longer. By binding to the same receptors that natural growth hormone-releasing hormone binds to, Tesamorelin signals the pituitary to secrete more growth hormone in a pulsatile fashion. That growth hormone then acts on the liver and other tissues to stimulate the production of insulin like growth factor 1, commonly known as IGF-1. Together, growth hormone and IGF-1 drive processes related to fat metabolism, lean body mass, and tissue repair. One of the key features of Tesamorelin is its effect on visceral fat. Studies have consistently shown that patients receiving Tesamorelin experience significant reductions in abdominal visceral adipose tissue. This type of fat, which accumulates around internal organs, is strongly linked to insulin resistance, metabolic syndrome, and cardiovascular disease. By reducing visceral fat, Tesamorelin may improve metabolic health, insulin sensitivity, and lipid profiles. Unlike some other peptides and hormones, Tesamorelin appears to have a fairly targeted action. In clinical trials, patients lost visceral fat without significant loss of subcutaneous fat, the type of fat found under the skin. This makes it particularly interesting for improving metabolic outcomes while preserving normal fat distribution. Another important point is the impact on IGF-1 levels. Tesamorelin reliably increases IGF-1, but it does so within a range that is generally considered physiological rather than excessively high. That balance helps reduce the risk of side effects that might occur with direct growth hormone administration. Speaking of side effects, let's talk about them. The most common reported side effects of Tesamorelin include injection site reactions such as redness, itching, or pain. Some patients report joint pain, muscle aches, or swelling of hands and feet. Because it stimulates growth hormone, it can also influence glucose metabolism, so patients with diabetes or pre-diabetes need careful monitoring. In some cases, Tesamorelin may unmask latent diabetes or worsen glycemic control. Now let's shift to off-label uses and areas of research. While Tesamoralin is officially approved only for HIV-associated lipodystrophy, researchers and clinicians are exploring broader applications. There is interest in Tesamorelin for general obesity, metabolic syndrome, and even non-alcoholic fatty liver disease. Some studies suggest it may improve liver fat content and liver enzymes, which makes it an intriguing candidate for treating fatty liver disease. Beyond metabolism, growth hormone and IGF-1 pathways influence muscle mass, recovery, and possibly even cognition. Because Tesamorelin stimulates these pathways in a controlled way, some believe it could play a role in anti-aging protocols or performance optimization. Early data hint at possible improvements in memory and cognitive function, although more research is needed. Tesamorelin is administered as a subcutaneous injection, typically once daily. The approved dose is 2 milligrams injected into the abdominal area. Like many peptides, it comes in lyophilized powder form that must be reconstituted with bacteriostatic water before use. Patients then use insulin syringes to inject it under the skin. Adherence to daily injections is important, as stopping therapy typically leads to a return of visceral fat accumulation. Cost and availability are also important to consider. Since Tesamorelin is FDA approved for a specific indication, it is available by prescription under the brand name Egrifta. However, it can be expensive, and insurance coverage may be limited to patients with HIV-associated lipodystrophy. Outside of that, some people seek compounded versions from peptide pharmacies or research supply companies, though quality and legality can vary. Let's think about how Tesamorelin compares to other growth hormone secretagogues, such as Sermorelin, Ipamorelin, or CJC-1295. While all of these stimulate growth hormone release, Tesamorelin is unique in its FDA approval and in its strong track record of reducing visceral fat specifically. Sermorelin and CJC-1295 may also elevate growth hormone and IGF-1, but they are not as targeted in terms of clinical outcomes. Ipamorelin works more through the ghrelin receptor pathway, making it slightly different in mechanism. Another angle to consider is long-term safety. Growth hormone therapies can raise concerns about cancer risk, fluid retention, or cardiovascular issues. The data on Tesamorelin so far have been reassuring. While it does raise IGF-1, it has not been linked to increased cancer incidence in the population studied. Still, because it acts on growth pathways, ongoing monitoring is recommended. Let's talk about who might be an ideal candidate. In its approved setting, it's clearly for patients with HIV-associated lipodystrophy and excess visceral fat. In a research or experimental setting, it may appeal to individuals struggling with central obesity, insulin resistance, or fatty liver disease. Athletes or biohackers sometimes express interest due to its potential for body composition and recovery, but again, off-label use carries uncertainties. It's worth mentioning the psychological effects as well. In some studies, patients reported feeling more confident, energetic, and motivated as their body composition improved. Reductions in visceral fat can lead to better self-image and reduce stigma, particularly in patients dealing with lipodystrophy. These quality-of-life improvements are just as important as the metabolic changes. From a biochemical standpoint, Tesamorelin highlights the power of targeted peptides. By designing molecules that mimic natural hormones but with greater stability, Scientists can create therapies that fine-tune specific processes in the body. Tesamoralin is a prime example of how peptide science bridges endocrinology, metabolism, and clinical medicine. There are still open questions about tesamorelin. How does it affect long-term cardiovascular outcomes? Can it be safely used in broader populations with obesity or metabolic syndrome? What are the cognitive or neurological effects of chronic growth hormone stimulation? As research continues, we will likely learn more about both the benefits and the risks. For now, tesamorelin stands as a unique tool in the peptide toolkit. Its targeted action on visceral fat, coupled with an FDA approval, sets it apart from many other experimental compounds. Whether its future lies in broader metabolic disease treatment or remains within its current niche will depend on ongoing studies and clinical experience. As we wrap up, let's quickly review. Tesamorelin is a synthetic analog of growth hormone-releasing hormone. It stimulates the pituitary to release growth hormone, leading to increased IGF-1. It is FDA approved for reducing visceral fat in patients with HIV-associated lipodystrophy. It has shown strong effects in decreasing abdominal fat, improving metabolic health markers, and possibly aiding liver health. Side effects include injection site reactions, joint pain, and possible effects on blood sugar. Off-label, it is being studied for obesity, fatty liver, and even cognitive health. Compared to other peptides, it stands out for its targeted visceral fat reduction. Disclaimer: this podcast is for informational and educational purposes only. It is not medical advice, and it should not replace consultation with a qualified healthcare professional. Always talk with your doctor before starting, stopping, or changing any supplement, medication, or peptide therapy. Thanks for listening, keep learning, and stay curious.